Okay.
Go, Keturah.
Okay, we are starting from the top. Um, once again, I just want to thank everybody for joining us for this meeting and of the Canadian delegates, registered trainers. We are glad that you are here. And like I said, our agenda is really somewhat very simple. One is to give you an update of where NADA is and some of the vision that we have. And the other is to see how we can be encouraging of you to continue to do the work of NADA in Canada, and for you to introduce yourselves and give one fun fact. And so I will start. My name is Keturah Bryant, and at this point I am the training chair for NADA, and I'm from New Haven, Connecticut. And my fun fact is that I'm a student of my 7-year-old granddaughter who is teaching me Mandarin. She gets a little frustrated with me at times, but it really is for her. It's not so much for me, because she's really has to know what she's talking about, and she takes it very seriously. And sometimes I just mess up just to make sure she is on point.
That's great.
I'll go next. I see I can remember some Mandarin from school, Ni hao ma, but that's all I remember. I'm Stephanie, Nelson, BC, Canada. Currently with NADA, I'm kind of organizing, supervising the program here called NADA Circles. I just got off work from the homeless hub shelter. Well, it's not a shelter, just a drop-in center, and it was awesome. We had like 9 participants and the whole room was NADA'd, and it's always super fun when a drop-in turns into the NADA zone. So I'm feeling the spirit right now. And fun fact, I like to build snow forts, and I'm actually a little bit sad because it keeps raining instead of snowing here. So fingers crossed we get some snow in February.
It's the same thing here in Ontario, Stephanie. Rain, rain, rain.
Rain, yeah.
I guess I'll go next since I've started chatting. So Veronique Leguay. I hail from Peterborough, Ontario. And I actually haven't, I'm itching to do another training soon. I've just done one since we started again since the pandemic. So, and I don't know, fun fact, I love reading science fiction. My daughter peeked up, she's like, oh, what's my mother gonna say about myself? I had to keep it clean.
We have Dr. Nadira.
I'll go next. Can you hear me?
Yes.
Absolutely.
Okay, my name is Nadira Hiralal. I work at Unity Health in Toronto. I am a case manager. My title just changed, and I'm a trainer now for, I think it is 10 years since I became a trainer. I haven't done any training because of the pandemic and the hospital policies around groups, but we still offer treatments to our inpatients clients. Fun fact about me, I can't think of one. I just like to be a kid with my grandkids, just like Keturah. It's like when they're around, I think I become this big kid amongst them.
I hear you.
And I have 4 of them.
Oh, wow.
Nice.
I will go next. My name is Daksha. I'm from Ottawa, Canada. And I'm not doing anything, no training. Like since pandemic and the NADA is changing, so it is complicated to do some training. I have some places they are asking me to go and train people, but I cannot do it right now because lately NADA situation has changed. So I feel like it's complicated. So I'm taking step back and looking at the snow and enjoying myself.
Okay.
Thank you, Veronique. Nice to see you.
Nice to see you, Dr.
And everyone. Yeah.
I will echo what Daksha just said about, yeah, it feels complicated, and I'm taking a step back as well. Even though I feel like there's not a lot, there's not a lot of trainers, I don't believe, in Canada, or at least accessible. So I don't like doing that, but it feels like I've got to figure this out, and it's, yeah, it feels complicated.
So I want to introduce myself. Thank you, Veronique, for those sentiments, and Daksha. So my name is Victoria Taylor, and I'm a trainer from Southwestern Virginia. I'm also a member of LARGE on the board, and I assist Katura as on the training committee. And the training hasn't changed, the manual is the same. And I'm in the middle of leading a training right now in Henrico County, Virginia. And being in the training room, it's so great. Like, it is so great to see people become enrolled and see their mind shift that, oh, how can I work this in as, an adjunct to the work that they're doing in mental and developmental health. And it is Katura's and my commitment, I think I can speak for Katura, that even though it seems complicated, it's really just register people, pay their dues and their training fees, and train. Because and I know Katura's just recently returned from a training, there's nothing better. And my fun fact is that my husband and I own a historic resort in southwestern rural Virginia. It's not operational, but it's a pretty cool front yard. So my commitment is really to handhold everyone so that we can get people back training and we can build back up the trust, because we haven't changed the training. We just changed how you enroll people and get paid. And Katura will talk more about that. So I encourage you all to, yeah, that's all I want to say about that.
So yes, we have gone through what I would say a metamorphosis with NADA, and we've had to just really kind of, just like a butterfly, from a caterpillar to a butterfly, we've had to just kind of break it down to its purest form. Some of you, with the correspondence from the president, Dr. Carter, he recognized for us that the agency, we needed to function in a more professional and legal way in order for us to, one, maintain our 501c3 status, which is a not-for-profit, and our bookkeeping was not what it should be. And so in order for us to move in that direction, we had to be in compliance with what the IRS was expecting us to do. Otherwise, there would be no NADA. And we knew that that wasn't an option. And so we have been shoulder to the grindstone for about 1.5 years now, almost 2 years, of all of us that have been on the board and some volunteers, and all of us on the board
All
are volunteers.
All
Um,
volunteers.
100%. And it has been literally hours of trying to move us to the 21st century. We were a paper-driven organization, as you all well know, sending in paper packets, some getting lost, some just getting misplaced. It was an accountant's nightmare. So we had to figure out a way, one, to become more digitalized so that the accounting would be kind of an automatic thing. So that piece really, if you are posting a training at this point in time, it really is not that complicated because you'll post your training. The people that want to do your training will come to the website, and that's pretty seamless. They will fill out their whatever it is your fee. They will fill it out. They'll fill out the form. They'll pay, and then you will have to have done a number of things to make you in compliance to even post your training. So prior to posting your training, they're going to ask you, are you current with your NADA membership as well as your RT membership? Do you have liability insurance? As a trainer, according to our attorneys, we all should be carrying liability insurance. You will have to register with a program we call Gusto, which means that you would register your bank account so that you could get paid as people are registering. You would then also have to fill out in the US a W-9 form, and don't hold me to what the equivalent would be in Canada. Maybe Victoria knows that piece.
It's a W-8 form, and then that goes to the accountant so that she can send you once a year, at the end of the year, a paper saying what income you earned through a United States company.
Mhm. And so basically how the system has changed is that you are now an independent contractor with NADA. That is the only difference. And in being an independent contractor, we have to be accountable to the IRS. And so what happens is your person comes on and they pay for your training. NADA takes their 15% for admin and administrative fees, and then they immediately forward you 85% of whatever your training fee is. So it's important that you think realistically about what your training fee will be. We will have according to the IRS now, we have to have a cap on what the training will be and what those fees will entail. We're still working that piece out. So for right now, you set your training fee and then you proceed. So it really isn't that complicated. You also have to sign what we call a non-disclosure, an NDA. And basically that is to maintain NADA's proprietary information around our logo, around the things, as trainers, you'll be aware of grants and things that we are trying to do to move the organization forward. We recognize that everybody can do 5 points on the ear, but you can't call that the NADA protocol because there's certain things that go with the NADA protocol. We're not just 5 points to be the NADA protocol. It is an adjunct to treatment. You therefore have to add all of those other things to the NADA protocol. It prepares people for the actual treatment for behavioral health intervention. So those are the kind of things that are proprietary to the NADA protocol. So you just can't say, we're offering you the NADA protocol, and you're not offering these other adjunctive services for individuals. Now, you can be a licensed acupuncturist. That may, the treatment end of behavioral health may not be your forte, but you will have to document that you have collaborated or that you're in partnership with a treater. The NADA protocol is never a standalone treatment, and we say that throughout our documents. The other thing that we are working on, and hopefully we will have all of this in place, is that your manual will have a digital form to it. I used it for the first time in Seattle. And it really does offer you some creativity as to when you want to offer certain things. It really is like a blueprint for the things that you need to offer. There's a sections in there about DEI, diversity, equity, and inclusion, belonging and acceptance. You got to talk about obviously the 5 points and how they may benefit somebody. You need to talk about what are some of the adjunctive treatments that individuals can be involved in and should be engaged in. We talk about how do you structure it, all of those things that are in your manual, but it's now on a slide. So when I was doing it, it was like, what do I want to start with first? I have my own style. It does offer you an opportunity to have your own style. So we are hoping that by February 15th, we have a deadline that we will have it to the board for board approval, and then it can go to the attorneys for the attorney approval to make sure that we are, not that we're in, not plagiarizing or not giving people, recognizing other people's property, intellectual property as well. So those are really the two major things that that we have done. We are still honoring all of the individuals who you did training with prior to us going into this digital platform. We are honoring paper applications still, and we will honor them until the end of 2023 because you were given a 2-year window once we went into the pandemic so that people could make sure that they got their 40 treatments in and all of those things. So we are still, we need trainers to use the system, give us feedback for the system. We must hear from you. Our goal, because after I did my most recent training, I had a laundry list of things. I was like, no, this isn't working. You got to change this. But the only way that we will know it is for us to use it. We can write down to the programmers all of our desires, and we won't know whether that works until we work it. And then we get the feedback because we'll have an eval from the trainers that come to the training committee and says, this didn't work or this worked. This was frustrating. This was smooth. We need to hear from you, and we want to hear from you. Anything else, Victoria?
I think that Daksha has a question and also Stephanie has a question.
Okay.
Go ahead, Stephanie.
Okay, so to clarify, Katura is now, this makes me excited. So there is a template slideshow that we can use for a presentation. And then there also is, what there was in the past is there's a PDF file of the manual that you can send to the trainees so they can do pre-reading prior to the course. So those will,
yes.
And that will be available mid-February, the slideshow.
The slideshow will be available. Well, we have to submit it by mid-February. It has to go through the board and for those approval. I would say, definitely by the conference in June, it'll be ready to roll, and we will, have it available. It'll be posted on the website for trainers to to use. And the beautiful part is if you want to, give certain slides to your trainees for them to read, look at, or, you get to explore, then you can forward that to them as well. So, so it'll be a living document, one that hopefully you will use as people do the manual, but you can still use the manual because there's some archived information in there that we definitely need. But the issue for NADA, in order for us to begin to apply for grants, there's a ton of money out here for this opiate epidemic. There's a ton of money out here for treatment. We could not, in the current state that we were in, we could not apply for these grants. We were not in compliance with our 501c3. So our goal and our vision is to be able to apply for grants that are like service grants, that we can offer scholarships for training. We can offer scholarships that, for you to be able to say, NADA, can we have this? And we can also give you a template for other grants. Once you, having been in, now that I'm writing grants for my own business, once you write that template, you can kind of plug in to almost any grant because there's certain universalities. I'm not sure what is being offered as far as grants in Canada, but that's one of the things that we want to do. Also, we want to be able to offer research opportunities for NADA, so that let's say we get a research grant to look at
Compliance.
how many treatments is impactful. Is it 10 or is it 20? Okay, so we want to be able to offer that, and that if your facility or my facility or my private practice wants to participate in that grant, we want to be able to say, look, we can have a multi-site grant. We want to be able to participate in that. But we can do that now. We could not do that 2 years ago.
Another aspect about that, and with the slides, for example, and the pricing and the registering, is that in order to be in compliance, we had to demonstrate that the training was consistent across the world. And although we always said the NADA brand was consistent, there were people doing 1-day courses and people doing 10-day courses and people only training on 3 points. And so part of this effort in this reconstruction is to still, as Couture said, make sure that our RTs have bring their own style, their own humor, their own timing, but that the registration and the materials are consistent.
Stephanie had her hand up, and then Daksha. Stephanie, do you still? Okay.
I guess I'm just confused. So how will those grants be, or will they be transferred to Canadian trainers as easily as American trainers?
Like I said, I'm not sure what your country is offering in reference to this pandemic. But we hopefully will have a committee that can help you to begin to sort it out. And we're looking for RTs. Once we put this manual out, RTs are going to be required to be committee members, active committee members. One, so that you can have an input in changes. Find the committee that resonates with you. If it's grants and advocacy, legislative advocacy, then join that. If it's training, join that. If it's grassroots, join that. We don't want you to reinvent the wheel. We want you to go where your passion is. But it's important, if you're going to be mentoring people, you want to mentor new RTs, it's important, we think, that you are actively engaged in what we are doing. And it'll make it so much easier for all of us because we can do things individually, but we can do so many, many more things as a collective. Daksha, you have your hand up.
seems like many things not going to be easy for Canadians.
Well, that's why we need for you guys to
And
be,
what I see, like so many emails I was receiving, and already even American trainers were having troubles about the getting certificate for their trainees and all that, and it's still taking long time, and so many time and
We have
mistakes and
caught
things
up.
like that. So standing in the line, I don't know where Canadian will be, you know. And about the finance, about the payment part is that again, for the tax file, it will be complicated for Canadian also. After
so
15% or this or that. So those kind of things, I think I like to have it simple. It was working okay, but since you guys said it wasn't working good, so I don't know, I will be out of it.
well, I'm hoping that won't happen. First of all, it's always has been 15%. It's only been over the last couple of years that all of a sudden when I did a training and they was sent this new paperwork, and it was like the board did not approve for it to be a flat fee of $35 per person, because that's not fair. At that moment, it was not fair. Because if I chose to do a training for $100 and I paid $35, you chose to do a training for $500 and you paid $35. There's something wrong there. But if it's across the board, which is in your manual, that is what it says, 15%, then that's 15% across the board. So, it offers parity no matter who's doing the training. And because we are now having to codify that and say the training will be X amount of dollars, and you can do whatever you want with that X amount of dollars, but the agency will you still have to pay the 15% so that we can continue to be relevant. So it's this is why we are saying we need you.
We don't mind to pay whatever the amount, but to me it seems like complicated to go through step by step and all that NDA thing, and I don't know.
So I have a couple of
I'm
things.
not a business person, so it doesn't go in me that easily. And I
hear
feel like
you.
NADA is going into this too much business, so I don't understand that.
It's really the same. It's just you do it on a computer instead of on a piece of paper. You do the same steps as we've always done. And we're just asking for some verification to make sure that we're all in compliance. So that's your insurance. And the non-disclosure agreement is unfortunately lengthy, but nothing original or different. You sign an NDA when you go on every website you ever go on. So it's not really as big a deal as some people have made it out to be. And also, Daksha, we have cleared all the old, I think we've got every old application. Couture and I have worked very, very diligently and to get them all up to date. And so if you email me at membership@acudetox.com, your student will have their certificate within 2 weeks, for sure, within 2 weeks. And we have really, it was quite cumbersome in the summer, and there were there were some lost applications or duplicate things, but that is no longer true.
And you heard people's frustrations. And it was more than just about those applications. It was change. Change is sometimes uh, a challenge for some folks. And, we tried to, it was a challenge for all of us as we were trying to go through it and try to figure out a system so that we could go into this digital platform as well as make sure that all of those paper applications were taken care of. And when we discovered that people were submitting paper applications that were not complete, they were not legal. So then that created a backlog because we'd have to send them back to the registered trainer to send sometimes signatures of the trainee. So we plowed through it. We figured it out. It was a lot of blood. It was a lot of sweat, and it was a whole bunch of tears on everybody's part. But we were committed to making sure that it got done. One, because those individuals were entrusting those registered trainers with a service. They did their part, which they thought. And it was the registered trainers. We're the ones that have to make sure that ethics statements are signed. We're the ones that have to make sure that we've signed off on the application to say that this person is competent, that the person has signed off on it, that the person has said they have no legal encumbrances. When those things are not complete, it is a legal nightmare for us. And so which was the office's responsibility for many, many years. And so then when it came to my lap directly, and I'm looking at what people think is appropriate documents to send in, I'm like, no, we can't do this can't happen because we'll be at a liability. If you aren't making sure that trainee doesn't check that box and says they have no legal encumbrances to their license. And you send them to, but they really do because they've got some legal thing. They're on probation for abusing children, say, and you gonna do they're gonna be doing points in a young adult facility. We would be liable for that. Because the legally they aren't supposed to be within 100 or 1,000 feet of children, and unless they have checked that box and they have signed it, then the liability is with them. And so that's what we were faced with, and we had to send it back. We couldn't take anybody's word for it. It was a legal document. People needed to understand those applications are legal documents. We've satisfied that a great deal because people have to sign the ethics statement. They have to sign all of those things on the computer, otherwise the computer won't go forward.
And if it's any consolation, Keturah rejected some of my applications and I rejected some of her applications. So
Absolutely.
it wasn't personal.
It was business. And it was, okay, my bad. Let me just correct it. That's all you could do is just correct it. And it just said that, we're human first. And we recognize that. And we try to do this process in as humane a system for change as we possibly could. And that's where we were.
I know Stephanie's had her hand up, and then I'd like to also pipe in.
Okay, thank you. I have to go in about 10 minutes, so I'll listen to your question as well, Veronique. I guess, the mixed feelings. I understand pretty clearly what you guys had to do, and I'm actually pleased to see that what you said you would do, you did. I was on that conference with, I forget who the computer tech was, like showing the steps of the computer. It's happened in organizations everywhere. It's risk management. It's just where we're at, right? The world's gone digital. So I get that piece. And I think what's hard for the few of us here is there just feels like there's nothing left, especially in Canada. And I'm just wondering, like, how many trainers are there left in Canada and how many ADSs are there? And do you guys have that tally with you tonight?
No, I do not.
Okay.
No, we do not. I know that we need voices and we need the support of the Canadian representatives so that we can maintain this this relationship, maintain the work that is global. The issue around behavioral health issues is a global issue, and what we can offer to communities is invaluable. And so we're asking for your support, your help. We need a representative from Canada to sit on the board so that you will have firsthand information about, or bring your questions to the board so that as a board, we can all begin to brainstorm and take a look at what needs to happen and how can we be supportive of the change. It is a whole different country. It's like, if Great Britain, not a Great Britain or not a India or not a Philippines, we have somebody that is, I think is not a Ethiopia, that is looking for the board to help them to be more present. We don't have any jurisdiction legally in Canada. We need Canadian reps. We can be supportive of the Canadian representatives and the RTs and the ADSs, but I don't have access to monies and grants and fundings and program information. That comes from you, just as I don't have information about what's going on in West Virginia. I do have information about what's going on in Canada, and meaning Connecticut. So, but we can all come together and say, how can I be supportive of you in Connecticut? Do I need to come and help you train or whatever it is? So that's really what we're asking tonight is, is there any one of you that wants to volunteer to be the person that is the representative, the Canadian rep to the board? Because we don't have anybody. We haven't had anybody for almost 2 years. Since Julie, I can't think of her last name.
Julianne Naylor. Julianne
Yes.
Naylor was on the board. She stepped off in about March or April of last year and was not able to replace herself. And we don't know the Canadian concerns, like Daksha was saying. I don't think that'll fly in Canada. Well, we need to know what the Canadian concerns are in the Canadian conversation. So someone needs to be on the board so they can hear our conversation and be the translator and say, no, this has to be different. This needs to be this way because in Canada it's this way, like that.
Bro, it's hot.
Can I just, like, one of the things, I got the email this past week or so about the Gusto. And I went through a couple steps just to sort of take a look at it. And I ran into a roadblock almost immediately when it asked me where I'm from. And there was United States. So there was the list of all the states, but there was no opportunity to say I'm from Canada or, my province.
Mhm.
So I couldn't even go further from that. So that was probably like 2-3 steps in. So that is something obviously for you to know.
That's huge. Thank you. We didn't know. I mean, because we wouldn't look necessarily, right? So thank you.
Yeah. And I wondered if I don't know if my situation is slightly different than other folks on the call. So my agency, so I know that from your perspective, I'm considered, right, we're independent contractors for NADA. My agency paid for me to become a trainer. So I train, like when I've done trainings, I haven't taken a fee. I'm paid by my agency. And whenever I've trained mainly publicly funded staff, either within my agency, pre-pandemic, it might have been other publicly funded agencies. So we didn't actually charge them. We just did I think the $35, whatever went to NADA is what we charged. And we didn't charge anything extra. A few times I did train some people in town who worked for private agencies, so we did charge. My concern, what I was saying when it feels complicated, that's the piece that feels complicated for me, is this income tax piece for an American like IRS, when I wouldn't be doing this training independently. I'd be doing, so is it my agency that then has to go through this American, and they don't want to do it. They don't want to deal with IRS. So that also feels like, so my ED said, so maybe we don't do any trainings for outside of forecast now, because that's the way to keep it simple. And yeah, so those are the steps for me that feel like I can't wrap my head around them.
Yeah, so I'm in the process of working on the agency sign up, because most of my trainings are also for agencies, and it is a little different. The initial system that we have set up is designed for personal trainings, and we're working on the agency training. And so I think I'd like to actually schedule a call with you so we could walk through some of those pieces.
Okay.
Essentially, what I've been doing with the agencies is I've been doing what I've always been doing, and I've been sending the fees and the membership fees by check to NADA. I mean, we're not going to tear up checks. You know, you send us membership fees, we'll enroll the members, right? And then I have a coupon code that Richard has provided. So I think what we should do is schedule a call, you and me. So email me at membership@accudetox.com, and we can talk through that personal concern about it.
Okay. Thank you.
That's why we're here. That's why we're here. This is a listening session. We don't know what we don't know, right? And Couture and I have just been doing what we know.
Daksha?
Go ahead, Nadira, go.
I just have one question. I've never had liability insurance because I'm covered under my hospital. And now if I decide to, because I am not sure where I stand with training within the hospital because of the pandemic, and God knows when it's going to be open to in-person and trainings. So it will be that I have to venture out to do training for agencies that need trainings. And so I am not sure about the liability insurance. So if anybody have liability insurance from Canada, I would just like to hear how they get that.
If you have it with your agency, then you're covered.
Yeah.
For that agency, though.
But for the, if
it's in the
that
hospital,
particular agency,
yeah,
and we would just need a statement of a face sheet or covered what the coverage is for their employees. If you're going to go out, maybe Veronique or Stephanie or Daksha can talk to you about liability insurance if they are doing any independent trainings. I don't, we know that, I don't know, the American Acupuncture Council, they may be covering outside of the US as well. I don't know. What do you all use, Veronique or Stephanie or Daksha, for your personal liability insurance? I always carried that in addition to my agency insurance, just because I was doing stuff outside of the agency.
Uh, American, they don't cover Canadian. No.
So what do you all use
We
for
have,
liability?
I can send you guys what I have. Yeah, we have the, right now it's not coming to my, and it's in the paper. Yeah, and like lately, last 3 years, I'm not doing anything and I'm thinking about giving up, like out of NADA. So in case if Canada create NADA Canada, then I may think about it. Because some people in Canada, some youngsters, they may want to go NADA Canada. And that would be good because all different countries has their own NADA.
Mhm.
So, or they don't use a NADA Canada, they can use other name. That's what they were talking about. But my role will be very small. I do have so much passion for NADA, like all the work and training and what Dr. Smith taught us and everything. But I don't know how long I will be with NADA.
Okay. So if you all could share with each other whatever liability insurance that you have, whatever it is that you use professionally, that would be a great thing. I don't use American Acupuncture Council. I'm a nurse. I use, Nurses Services Organization, which I've had for, since I was a profession, since I've been in nursing, and they cover. They've added I have a number of writers that cover stuff that I do out in the community, from training to, all of that stuff. But that's what I choose to use. Victoria probably has something different as an acupuncturist.
Veronique, I gave you the name, that one. You remember when
Oh gosh, no, I'm sorry.
I have to go to my paper and bring it out and send you copy, you and
Yeah.
Rafina.
Yeah, I know that, again, I'm only covered through my agency. I don't have anything extra. And I know that when we first started, shortly after we started doing AccuDetox, and we needed to sort of show proof of our being covered, we had to actually switch insurance providers because the one we were under wouldn't cover NADA protocol. So I don't know offhand who we're with, who we switched to. But yeah, I don't even know. It feels like it's not so easy, right? There are places that won't cover you.
Yeah. So, yeah. But I think that's a mechanical thing. If you want to practice, regardless of what your practice is, whether you're in psychotherapy practice, NADA, a licensed acupuncturist, you do have to have liability insurance.
Yes.
So.
I think that Tracy Penny Lockhart joined us. If they would like to introduce themselves or say hello, we are sort of wrapping up, but welcome.
Hi, sorry about that. I looked at my clock and thought, oh my gosh, it was started. Anyway, I'm in New Brunswick, Canada. That's where I'm joining from. And I was actually really looking forward to coming to the meeting to find out about some of the changes and whatnot. And I am really sorry that I missed the majority of it.
Well, we did record it, so I will send that to you in the morning.
Okay, that would be great. I actually do need to reach out just because myself and my colleague, who are trainers within our organization, have kind of some different circumstances because we work, we don't do the trainings privately. We work for an organization and you guys may have already discussed that, so. But,
I just brought that up, Penny, or Tracy rather. I just brought that up because that's my situation as well. I'm in Ontario. Yeah, yeah,
okay, so you work for like a public organization?
that's right.
That-
An addiction counseling agency. Yeah, yeah.
We work in
So
addictions and mental health, yes.
there you go. Yeah, so same
Okay.
situation. So Victoria, I don't know, I should just let you talk. Victoria was suggesting
please.
that she and I might have a private phone conversation to talk through it further so she can walk me through it.
Okay, yeah, and that's what I figured I would have to give Nada a call and talk about that piece because of,
Don't give a
Yeah.
call, send an email to me, Victoria, at membership@acudetox.com.
okay,
And
Okay.
then, because that'll cut out one more step, because
Right.
we're all volunteers and we live all over the country or the continent,
Okay.
I'm guessing, right? And so it would go to, a phone call that would get answered in North Carolina, and then I would get an email, and then I would email you. So just email me.
okay. I'm going to grab a pen and a paper and write that down. I'll be right back.
Yeah.
Can I
Any
ask,
takers for the board?
Or at least to check it out.
how often are the meetings?
Good question.
Right. So at this time, we have an executive committee meeting on Friday. One Friday a month is open and one Friday is just the executive committee. And then we have one board meeting monthly on the third Tuesday, 8 o'clock Eastern time.
Okay. So monthly.
So the EC meetings on Friday, the open one is where, let's say you have a concern. So you would bring it to that meeting.
So it gets on the agenda.
Right.
Okay.
And then, they kind of try to ferret it out. And then, if it warrants that we need to bring it to the full board, then it would be put on the agenda for the next board meeting. So at this moment, it's not so labor intensive as it was prior to this moment. We were meeting almost weekly. It was insane. It was intense, but it was what we knew we
Almost
had to do.
weekly. We were meeting weekly
I
and
know.
almost daily.
Almost daily.
Dr. Carter and I spent 4 hours this weekend alone walking through the system. So
I know,
we're
I know.
paying
But
attention.
we don't, it's not going to be as intense for the Canadian rep or the RT rep. They're not part of the, that executive piece. So, but we're also looking for people to be on committees. So, go look and see what committee that you would like to be on. And, you have to make sure you're current and that you signed your NDA and so that we can go. I think people, I don't know, I've worked in research a lot. And so an NDA wasn't intimidating for me. But, you go online and what is the first thing that you got to do? You got to agree to the terms of agreement. That's equivalent to that. That's basically what it is.
Uh-huh.
Anything else? It's 9 o'clock. We
But
don't want
wait,
to
I
keep
have
you.
something fun to do because Tracy just asked a question. Look what I prepared for you guys. Do you see it?
No,
No.
what we supposed to be looking at, Victoria?
Oh, dang. Oh, hold on.
I hear
this.
somebody
I
in the
didn't hit
background.
share.
Huh?
Now do you see it?
Oh, okay, yes.
I actually had shared that. I had just not shared it. Yeah, we have lots of email addresses, but that's the one I monitor.
Okay, that's good to know. Yeah. I guess this isn't for tonight. I know we're wrapping up, but just a curiosity I have. Daksha had mentioned that, yeah, some people have thrown around the idea of like, could we create a NADA Canada? I'm curious if the existing NADAs in other countries. I don't know what you call them, branches or whatever of NADA. Do they go through the exact same protocol now online, or is it essentially they're a separate agency or
Mhm.
organization?
Mhm.
If they
No.
want our certificate, so there are people who live in remote places like Africa that come and get training in the US and get a US certificate
Yeah.
from the NADA organization. But if and so that certificate is recognized very broadly in the United States and Canada, is the NADA organization certificate. And most of the laws are based on that NADA certificate of completion. So we don't issue, so if someone applies through our system and they meet our competencies, then we will give them a certificate of completion. We don't know what they're doing in England or India or Nepal.
Okay. Okay.
Then they're dealing with their own compliance with their own
Yeah.
governmental
Yeah.
organizations.
But that is a possibility.
Yeah, it's actually a great, if that's
Sounds like a good idea.
then that's a great thing to do. Right? Then the money would all be in Canadian dollars and the W-9s would all be Canadian,
Yeah.
tax forms. It's
Yeah.
if someone has energy for that, it's not
Well,
a bad
I think that's where it's kind of been like, who has energy and time for that? Because we recognize it's a lot of work.
But you don't have to necessarily reinvent the wheel.
You
You have a manual. I mean, it would just be a matter of, like a textbook. Textbook may have been written in the United States, but that doesn't mean that it can't be an official textbook in Canada, right? So, it may require some agreement between, not a US and not a Canada that, we can share information. So I think it's, let's explore that option if you have folks and, there are people, we're here to support the growth.
Okay.
And, because we do have, the thought about, because we're getting more inquiries from different NADA branches, NADA countries. And at the conferences, we've had NADA, Great Britain and NADA UK present, NADA Netherlands, Ireland. They come to the conference and they present what are those wonderful things that they're doing in their country.
Yeah.
So the same thing can happen with the NADA Canada. And, there's been talk about having 1 or 2 international reps on the board of NADA US. Those are things that that's part of the vision now that things are, a little bit more stable, that we can, and our charter can accommodate an international representative on our boards.
Okay. Thank you.
Yeah, we only want people to use the protocol, get trained in the protocol, and we're somehow over the last year there's been a belief that the board was like hiding NADA and keeping it secret, and I think the NDA kind of fed into that. But the truth is, we want it to be used. We want to make training easier to access, easier to fund, more cooperation and communication between practitioners and trainers. So yeah, let's nip that myth in the bud that we're wanting to keep it to ourselves. We want it everywhere. Sometimes I just think about like one of my friends stopped training, and I was like, oh my gosh, NADA's dying. And then I think about all the people in these counties that have never even yet heard of it, right? So there's no lack. There are 8 billion people who need to get the protocol. There's lots and lots of opportunity.
And I'm sure you all can speak to the substance use disorder epidemic that we are, well, it's pandemic at this point, that, we're all struggling with that. And, we're looking at, this is a beautiful tool that is non-pharmaceutical based. It is community based. We can teach communities. This can be part of what I've been telling people. This can be part of your community first aid kit for behavioral health. We can, expand the laws throughout Canada so that any and everybody can do this. This is one of the things that I want to work on in the US. They're talking about allowing any and everybody to have naloxone. That you can have a whole naloxone first aid kit in your house. They're giving them out like candy in New Haven because we have such an overdose problem. So you can train somebody that has no behavioral health anything to carry it to administer naloxone to somebody that they think might kind of sort of be in withdrawal. And what if they're not? What if they're just asleep? And then you putting this in their nose and, so for me, it's like those needles cannot hurt you ever. Unless you obviously, if you're, a little bit off and you want to put it in somebody's eyeball, if they let you do that. But for the most part, these 5 points, they're not going to hurt you. Even if you're a little off on your 5 points, it's still not going to hurt you. But it can make the difference in somebody relapsing to say, come to my house. Let me give you some acupuncture. That can make the difference of whether somebody chooses to relapse or chooses not. And we know that the longer a person stays clean, that the possibility of them overdosing is exponentially at risk if they've been clean and sober for periods of time. So if you think that, okay, I used to do 2 bags at a hit and you haven't used in a year and you shoot up 2 bags, you're not going to make it. But that's part of the educational piece that has to get done, and we all are aware of that. So.
Mhm. Mhm.
Well, it's almost 9:10. Any other thoughts or feelings that you would like to share? And there's a difference. I always tell people thoughts, and they say, Couture, why do you say thoughts and feelings? Because they're 2 different things. So if anybody has any thoughts or feelings at this time, this will not be our last time that we will gather. I would like to, for us to gather periodically, like perhaps, quarterly, that, but every 3 months or so that we can come back together, and hopefully you'll bring more people with you at the next meeting, and that you'll have a little bit more direction as to where does Canada want to go, and how can we be supportive of you in the direction that you would like to progress in. We want everybody to be happy with where they are. We want you to be able to do your work, this very, very important work in your space.
Right.
And
And the
how
last
we
thing we
can-
want to do is occur as oppositional, right? In the way, making it too complicated or trying to stand in your way. We're
You
your
all
best
know your
friend.
system. We don't know your system. You know your system, and if we got technical assistance that will help you. So let's see what we can do, how we can be supportive.
Many people, they becoming members in what it called POCO or POCA or something like that. Like lately I heard here, I didn't look into it, but many members, NADA members, they are going there.
But the
So
same
POCO
situation.
look like doing they said they are doing the same thing NADA is doing.
But they're not directly about behavioral health, and we are directly about behavioral health. And our niche is substance abuse and behavioral health and community
Like
health.
for me, I'm not like, I have my family responsibilities, so I'm not going to be thinking about different things, but I hear things,
Sure.
and it's bad that NADA is the same anymore. I hope it spread and grow more.
Thank you. And we which one? I think it was Stephanie before she left. She was saying, she was looking forward to the snow because that was symbolic of winter and a thing that she enjoyed doing. And we have to understand that all things change, all things evolve. Nothing stays the same. It'll either erode if you don't take care of it, or it'll grow. And NADA is in a growth space. That's what we're doing. We are growing. And if it means that we support Canada becoming NADA Canada, then that's a beautiful thing. But we could not remain the same. We were going to die. And if someone, we know that in behavioral health, somebody comes to us and they say, no, I don't want to stop drinking. Nope, I don't want to stop using. Nope, I don't want to stop doing all these unhealthy things. I've had people say that to me walking into the clinic, and I say, you know what? That's okay. You can continue to do all of those things, but you can't stay here and do that, because the expectation is that you're going to change. We're going to support change. We're going to support you growing in a different direction that you want to go in. And if this is the direction that you want to go in, I'm going to support that too. No harm, no foul. And when you want to do something different that's in alignment to what we're doing, I'm all in.
That's right.
So change is a beautiful thing. I think of NADA as the butterfly. If anybody's ever looked at the butterfly, it's a larvae and then becomes a caterpillar. And then it goes through that metamorphosis where it literally liquidates and nothing is left but the DNA. And then the creator pulls all of that together and it comes out of the cocoon, out of that chrysalis, as a beautiful butterfly. We have cracked the chrysalis and we are becoming the beautiful butterfly that we are. So I want to